Welcome to the Vitamin Professor podcast, brought to you by VRM Media, publisher of Vitamin Retailer and Nutrition Industry Executive magazines, in partnership with Nutraland USA. I'm your host, Dr. Gene Bruno, Professor Emeritus of Nutraceutical Science and Chief Scientific Officer of Nutraland USA. The purpose of this podcast is to help educate the dietary supplement industry about the science of nutraceuticals and other relevant topics. If you like what you hear and see, don't forget to like and subscribe. Now, let me tell you a little bit about our guest today. Rick Handel is a 53-year veteran of the nutraceutical industry, and I just have to say, there's only a couple of people out there who have been in the industry longer than me, and he's one of them. He's got a really strong background in formulation, R&D, GMP manufacturing of dietary supplements, and Rick is celebrating 30 years with the industry-leading manufacturer Vitaquest International, where he currently serves as the Senior Vice President of Commercial Operations. Now, in that capacity, Rick is responsible for driving sales and innovation by identifying and developing new strategies, business opportunities, science-backed ingredients, and novel delivery systems. Rick actually holds 8 patents and has presented his published scientific papers and studies at conferences around the world. Rick is going to talk to us today about what the dietary supplement was like 50 years ago, where it is now, where it's going moving forward, and all of that. Welcome, Rick.
Oh, thanks, Gene. Thanks for all the kind words and telling me things I didn't even know about myself.
Well, that happens. As we get older there, we forget things about ourselves. So there you go.
That's true. That's
so,
what we do have in common. We are both old.
We are both old. That's right. Rick, my gosh, you started in the industry in 1972. I started in 79. So you've been in there 7 years more than I have. What was it like back then? Can you share what the industry kind of looked like and maybe how it's a little different from today?
Yeah, it was a lot different. First of all, it was really the Wild West.
Yeah.
It was an industry that really had not been given the ability to live and to thrive and to operate under a set of rules. Even dietary supplement GMPs weren't first proposed until 1997. So in 72, what it really was a bunch of people centered in certain areas of the country. And with me being a pretty much lifelong New Jerseyite, that was one of the hubs of the industry as it was growing, New Jersey, Long Island, New York. And these were all people who were generic drug manufacturers and finding it harder and harder to compete in manufacturing generics because they were having offshore competition for the first time.
Yes.
And so the low-hanging fruit for them were things that could be considered to be pharmaceutical or could be considered to be food, things like vitamins, for example. And so a lot of these people were very skilled in manufacturing. And, the only thing was there were no real rules. So people kind of made up their own good manufacturing practices as they went along. And, there was really no codifying of rules until I think the first was in 76 with Senator William Proxmire. Put forth a bill because FDA was trying to make it where if you exceeded the recommended daily allowance of a vitamin, it had to be prescription only.
Yeah, I remember.
Yeah, fun. And of course, there were all kinds of conspiracy theories about FDA being in cahoots with the pharma industry. I don't know. We just think they just really didn't think that a dietary supplement or vitamin industry was really worth their time, and they wanted to control it. So, but that was 76. That was like I would say the first time that we started having some type of boundaries that respected our right to be able to sell higher than RDA potencies.
Very good, yeah. Back then, before regulations came along, not only did you have those kinds of issues, but, there were some pretty outrageous claims being made about what the supplements could do. What were some of the more maybe outlandish claims that you remember?
Well, most of them would center around weight loss ingredients.
Oh my gosh, yes.
Which
Lose 20 pounds in 3 days.
Lose 20 pounds or more is what
Right.
one of them say. So why bother saying 20 pounds if you can also lose more? I think part of it was the way dietary supplements were being marketed at the time. And it was mostly print. I mean, vitamins were being sold by mail order catalogs. Vitamins were being introduced in tabloids like the Inquirer and the Star, or some of those checkout lane, like Women's World.
Right.
So in the front cover, it would talk about an Elvis sighting at a Dairy Queen, and then inside they were telling you about this, miracle guarana seed from Brazil that would just melt pounds away, or the grapefruit diet, or the cabbage soup diet.
Everything, yeah.
There were some crazy things, but I guess there were enough people who were willing to believe, buy, and try. But the people who were selling, a lot of the companies who were marketing weight loss products, they knew something about human psychology, which is that people who go on a diet usually won't stick to it for any more than about 2 weeks.
Right.
And that's why the whole idea of BOGOs came in, where buy one bottle or buy 2 bottles, get one free. Because they knew they had to, it was called front loading people. They had to front load them so that they would buy 3 bottles, and guaranteed 10 years later, 2 of those bottles are still unopened.
Still sitting on the shelf, yeah. I remember those exact claims, and mostly, I agree, it was mostly claims about weight loss. I mean, sometimes you found some, particularly unfortunate ones talking about, it's going to cure cancer or something absolutely absurd like that. But my gosh, it was just, there was no controls back then. People could just say whatever the heck they seemed to want without too much in the way of repercussions. It was just a crazy time. It really
because
was.
what happened, these pitches were written by the tabloids. They weren't written even by the marketers. You as the marketer would pay the tabloid to pretty much do the whole presentation and pitch.
Oh, absolutely. Yeah. So, I mean, like, we're talking about weight loss products. You remember KLVB6?
Oh, my goodness.
That was such a craze. For those of you who don't know, that's kelp, lecithin, apple cider vinegar, and vitamin B6. And that combination was supposed to be the magic combination to help you lose a ton of weight, those overnight sensations.
That was, and you're so right about overnight success. There was a rumor about how the KLB6 diet started, and I can't verify it.
Yeah, tell me.
They said that it was the brainchild of the founder of what is now Nature's Bounty, or NBTY, and that he happened to have a surplus of sea kelp in his warehouse.
Let's see, what can I do with this?
Yeah, but the thing is, it was built on some sound principles because kelp contains iodine, which helps with thyroid regulation. Don't know about the apple cider vinegar part of it. I don't know where
I still don't know about the apple cider vinegar part of it. Yeah, it's, which everything old is new again, and that has become a craze.
It sure has. Yeah.
And then, of course, lecithin, emulsifier of fats, whatever. So
so there were some scientific grains of truth in there.
Yeah.
In the same way there were with a lot of these. And also, we have to remember that the people who were the founding fathers of the companies, that today are, like the mainstays, like the Solgars of the world. I mean, this was started by people who was like, who really truly believed in what they were doing and improving the health of people by giving them things that wouldn't be in their diet. So, they couldn't be faulted for that. But some of the stuff was kind of crazy. I mean, like, I'm thinking, Gene, about, for a while, somewhere in the 70s, anything that came from or out of a honeybee.
Oh, yeah. Bee propolis, bee royal jelly, bee pollen, all of these, right?
I know. And, like, bee pollen has survived, and bee pollen's a good source of protein and stuff like that. But royal jelly? I mean, royal jelly is the substance that's secreted by the queen bee to turn worker bees into queen bees. So unless you're Beyonce, you have no business trying to be a queen bee.
Oh, there you go. That's well, so these kind of like some of these sensational craziness, these overnight sensations. Have you seen any of that change throughout the course of your career, or do you think it's still kind of the same? What are your thoughts on that?
No, I think that there's been a lot more dedicated effort to scientific substantiation of new ingredients that are
I
coming out.
agree.
You know, remember, Dr. Oz got himself in some trouble when on
Yes, he
TV
did.
he was talking about miracle fat burners in the bottle, and it turns out he was getting paid by whomever. It's not. I think that was a turning point, and what I'm seeing now is a much higher degree of science being used to support new active ingredients. And I think a lot of them really have promise, and a lot of them are showing that they do work. But back then, I mean, you could say anything you wanted about anything.
Do you remember a product that came out? I'm trying to remember what year it was. I think it might have been in the 90s. I can't recall. It was called Exercise in a Bottle.
Oh, yeah.
Supplement. I know the guy. I know the guy who came out with that.
Yeah,
it was
meaning
like, what are you talking about?
Yeah,
Exercise in
a
a
lot of
bottle.
caffeine, tons of caffeine.
Sure. Yeah, but I think it's definitely a positive trend that now, I think largely due to Deshay, but the efforts of good people in the industry, the good players who really want to do the right thing, have come out with nutraceutical extracts, the right stuff, with the right kind of research behind it. So it's becoming more respectable and not just something nutty, that didn't have the data. And speaking of which, so here's another example of something that started out one way and kind of went in a different direction. But I remember I think it was 1981. I remember because I was managing a vitamin store in Long Beach, California at the time. And the National Enquirer ran an article on, wait for it, spirulina.
Yes.
And it became an overnight sensation. And we were selling cases and cases of spirulina. People came in. And it's so funny how many people read an article in National Enquirer, the bastion of credibility, and come running into the store to buy a bottle of the miracle weight loss pill. It was crazy. And also, I wouldn't necessarily say it was the highest quality material
no,
at that
not in the
time.
beginning. I mean, I know a little bit of the story. The story of spirulina
Yeah.
goes to a gentleman named Dr. Christopher Hills. And Chris Hills was somebody who was looking to end starvation and
Yes.
nutrient deprivation all over the world. And he was a frequent traveler to Mexico. And on the surface of Lake Texcoco, which is a big, or Texcoco, I forget how it's really pronounced, was this bright green bloom of algae. And when analyzed, and he took a look at it, it had a tremendous source of protein. It was the richest natural source ever found of vitamin B12. I mean, it had high chlorophyll, and chlorophyll has antioxidant properties.
Right.
It was great stuff, and he tried to bring it around the world. But I want you to think about where it was coming from. It was coming from a giant lake in Mexico. And do you think that Mexican birds made detours around the lake looking for a place to poop? I don't know. So you were getting extra nitrogen, I guess, in your
There you go. Let's go with that. A little extra nitrogen.
But so the first spirulina that was around it wasn't the cleanest stuff, but the industry has grown because it's a valuable, very valuable nutrient, as are chlorella and other forms of algae. And so a manufacturing process was developed to keep it clean. Instead of harvesting it from the lake, they built these concrete raceways where the algae would be kept in motion and it was protected from any type of environmental issues, birds flying by, squirrels being curious, and it turned into a real industry. But in the beginning, they were saying it cured everything. And that always used to be the way in the Enquirer and the other tabloids. This is going to cure everything.
Right.
Yeah, go ahead.
I was just going to say, and one of the things I like now is if you actually go into PubMed and you put in spirulina and you look, you can find some real studies showing some actually positive results. And I've included spirulina certainly on when I've been formulating greens products, but making sure that there's a certain amount of it that's been shown that's a clinically relevant dose shown in human studies to be effective for a variety of areas. And it is effective in a variety of areas. It has some good data behind it. So
Yeah.
it went from being a sensationalistic ingredient to being something that's actually legit and has good research. It's evolved a lot over the years. Are you surprised about how much it's evolved?
I'm surprised not only in the evolution of the science supporting spirulina itself, but even that, now it got the attention of the food science industry. Because now everybody knows in the news is that there's a push to eliminate food dyes in
Yes.
food, in Lucky Charms and all this, and spirulina. Believe it or not, in spirulina, if you look at it, it's like a hunter green. It's a beautiful shade of green.
It is.
For that matter, at Vitaquest, we use spirulina for coating tablets because it's an extremely fine powder. It coats the tablets well, gives you a beautiful dark green. But here's the thing that they found about spirulina. If you take, and folks, boys and girls at home, you can try this too. Take some spirulina powder and put it in like a coffee filter and just pour cold water through it. And what comes out is a beautiful, brilliant shade of blue like Windex.
Yeah.
And now there's this, it's called phycocyanin. And now there are phycocyanin colors being used as a natural replacement for some of these dyes that we want to get rid of.
Beautiful.
So, yeah, spirulina was a great example of something that had humble beginnings and, has really had a lot of work and science behind it, and justifiably so.
Yeah, absolutely. Well, now that we're getting to the more, let's say, legit stuff, as I said before, you've been in the industry longer than me. I've been in here 46 years, and as I'm sure you do, I get a lot of questions from people about, what they can do, what should they take, those kind of things. But I also get a lot of questions about longevity. What are things that are beneficial for that? They want to know the insights on that. And that's one of the areas I've studied a lot. I've looked at, nutrigenomics. I've looked at different kinds of nutraceuticals that in different ways can be beneficial towards longevity and healthy living and all of that. But being that you are one of exactly two people I know that have been in the industry longer than me, the other one is Mark Blumenthal.
Yes, of course.
Yeah. I want to turn the tables and I want to ask you, what are some of maybe the biggest myths about the supplement industry that you have encountered over the years that are still persisting today?
And what I would do is I would even take weight loss out of that equation because,
Yeah.
that's something that was always difficult to have weight loss that was fat loss, first of all, and not muscle
First
loss.
of all, right.
And that was sustainable, et cetera. But I think you hit the nail on the head talking about longevity. And I understand why people want to increase their healthy lifespan.
Right.
Not just their life.
Key term, healthy lifespan.
And I think there are certain myths like it's when people start getting overly scientific in their delivery without a lot of real science to support it. Like there was a lot that was said about taking supplements that are supposed to increase your telomere length.
Right.
Right, the telomere being the part of the cell that is going to control that cell's lifespan before it gets senescent, meaning it's old.
Yeah, the sacrificial DNA, if you will.
Yeah, exactly. And whereas in reality, I think the key to longevity is dealing with confronting and controlling inflammation of all kinds. Because there are so many things that are tied into that. First of all, inflammation can age you physically.
Inflammaging, that's the term, right?
Yeah, there you go. But yeah, it also does all kinds of things. So, it's tied into your stress levels. Because if inflammation doesn't kill you, the stress that causes inflammation will kill you.
That's absolutely correct.
And that's one of the reasons why I talk about things that really do perform the way they say they will, adaptogens. Adaptogens help your body to adapt to all types of stress. Physical, emotional, day-to-day stress, you name it. So it really goes to, if it sounds too good to be true, it is too good to be true.
Well, you make a really good point. And one of the things when you think about longevity or healthy aging, that there is no, magic bullet. There's no single thing, whether it's telomeres, even inflammation, which is vitally important. There's, in the literature, you look at like 12 hallmarks of aging. They look at all these different areas, some obviously more important than others, like inflammation. But I think one has to try to do a variety of things to try to maximize the opportunity for a healthy lifespan, whether it's methylation, whether it's autophagy, whether it's telomeres, whether it's inflammation. But I will agree with you that inflammation is one of the ones that you can really impact, and there's some really good science and a lot of good nutraceuticals to help with that. So
I mean, antioxidants of every stripe, as I said, adaptogens, eating a balanced diet,
yes, all of those things.
Moving your body.
Yes, exactly. One of the biggest myths around the dietary supplement industry that I've encountered, and it's still prevalent today, is that dietary supplements are not regulated. That's the biggest myth that I see out there. Doesn't that irritate the crap out of you whenever you hear that?
Yeah, it really does. It does. Because it's almost like saying dietary supplements are unregulated and they're all crooks selling them to you. Which is, I mean, it's not true on either side. Because, look, even, I mentioned the Proxmire amendment to the Food and Drug Act earlier. And that was something that at least respected the right of the industry to live. However, the rules for how we were going to live were almost kind of like it was up to the ethics, honesty, and morality of the people who were formulating and marketing the supplements to kind of, establish themselves as either good guys or not so good guys. And the not so good guys, for the most part, they wouldn't stick around long. They'd have their one big product in the National Enquirer and then they'd be gone. Whereas you have, I think, if you take a look at like some of the major brands who have been around for, half a century or more.
Sure.
Those were people who, in a lot of ways, they had to make up their own rules for good manufacturing practices until finally GMP was established for dietary supplements. But it was always right. It was, even if we could say that the industry was largely self-regulated, it was being regulated. And one of the reasons that I stayed in this industry for over 50 years is because there are so many more good guys than there are bad guys. And I remember a time when the regulations weren't formal. Now they are. The industry, for the most part, including our company Vitaquest, we have an excellent relationship with FDA and with other government bodies and other authorities. CRN. I mean, we keep ourselves active in anything that is going to help for us good guys to continue.
Yeah, I agree with everything you just said. I wanted to add that one of the things that likewise irritates me and makes me laugh is the people who say that it's an unregulated industry will then make the statement that dietary supplements aren't even approved by the FDA. Well, there is no mechanism by which a dietary supplement is approved. Neither are foods.
That's right.
Which have. I mean, it's a kind of a ridiculous a statement.
Yeah, it's not FDA's job to approve supplements. That was one of the conditions of DSHEA. Was that FDA had to not exactly leave the industry alone, but they didn't have to have a lengthy approval process. This is one of the reasons why on most supplements that make any type of claims at all, there's a little box that says,
the disclaimer.
These statements, it's a disclaimer, these statements have not been reviewed by the FDA.
Right.
This product is not meant to diagnose, treat, cure, or prevent any disease. Why? Because diagnosing, curing, preventing, and treating diseases is what drugs do.
That's right.
And so that disclaimer was made to have a separation. This doesn't mean you can just come up with any product that you want and put it on the market. You have to let FDA know 75 days before you plan to market a product. This is what we're looking to do. This is why we think it's safe. And if FDA has any adverse comment and sends it to you, then you can't market that comment until all of that is worked out. But if your 75-day period goes unchallenged by FDA, as long as they've acknowledged that they received it and that it's not just sitting
You're
in a
good to
dead
go.
letter file somewhere, then you can go.
Yeah, agreed. So for those people out there who don't know that, who think that it's not regulated, it is. There's many regulations. We're required to follow those regulations, and there you go. So let's see. You've seen, I would say, the kind of the entire arc of the industry's journey, from those early days, to GMPs and beyond.
Yep.
What I'd like to hear your thoughts on some of the pivotal moments, like the passage of Deshay, and how that changed how supplement companies operate.
Okay, it's a long timeline, and I'm not very good at memorizing dates or remembering dates, but I do know that there were some people involved Deshay was the seminal moment because that was an act of Congress. Deshay was passed on the back of a grassroots letter writing campaign, 2 million letters sent to Congress. And there were people involved like, oh my God, Jerry Kessler, who was Natural Organics, Nature's Plus brand. He was tireless in what he did to turn that grassroots campaign into ultimately something that was law. Senator Orrin Hatch, Lauren Israelson. The heroes of the industry that unfortunately maybe a lot of younger people never heard about or didn't know, but these were the front line. These were the Fantastic Four.
They were. They did so much, and I remember that. And at the time, I worked for a franchised chain of vitamin stores called Greater Earth Vitamins, and
I know them.
Yeah, and I was the VP of education for them, training people about the supplements and all that. And one of my jobs was during that we sent out petitions to stores, and they would get signatures from all kinds of consumers on this, and then I had to collect those, take them, send them in, give them new ones, and we did it over and over and over again, and showed how many people, which were a whole heck of a lot, wanted Deshay. So I remember that very well. It was an incredible time, and I think it really was the single most pivotal moment in our industry's history.
Yeah, I absolutely agree. I was just thinking of another name. Actually, it's a family name that I wanted to throw out there. Attorneys, Milton Bass and then his son Scott.
Yes.
None of this would have happened without them. Milton Bass, as far as getting the Proxmire amendment written into law, and Scott for everything that he did for Deshay. It was a great time to be in the industry for me, because at a time when I thought that it might stagnate, the passage of Deshay said, no, now we're a real industry. And now we know what rules we have to abide by. And we've gotten pretty much everything that we wanted, because everything we wanted that we asked from FDA was reasonable.
Yeah. And so what's interesting is I was at the UNPA's member retreat last September, I think, in Utah. And one of the things that was being discussed there was, is there a Deshay 2.0? Is there, any changes, things like that, which are an interesting thought. We'll see if any of that happens, if we get anything new. I don't know if that'll take place. Now there's so much going on in government, I don't know what the likelihood of that is, but we will see. But yeah, that was a big deal. Now, you've been at Vitaquest for a pretty long time.
Yeah, 32 years here.
How, considering these regulations, how has Vitaquest kind of stayed ahead of them and ensured your customers are consistently really receiving that high level of quality based on those regulations?
By being proactive, by first of all seeking very good counsel from some of the law firms that specialize in our industry, and just basically saying, look, if we don't prepare for because the first draft of GMPs came in '97. It took years after that. I don't think that they were really put into law until 2009, and some aspects of it, like the labeling regulations, didn't go into effect until 2016, some in 2021. But the point is, we saw this all coming. And we said, you know what, it's going to reduce our profitability now for us to put all these things in place, for us to have, let's say, the quality department that we have now that has 100 people in it. But the thing is, if you don't do that, you're not going to be able to survive. And the one thing that we've noticed, whereas there used to be any good number of, I just call them the phony baloney manufacturers.
Yeah.
Ones who were operating out of garages, and who were marketing only the fad products. Or ones where there would be horror stories about the Board of Health would come in or FDA would come in and there'd be rat droppings and all stuff. We didn't want to be counted among them, and we knew that those kind of people couldn't possibly last. So we've had ever since I've been there, from the original founding Frankel family to our current management and ownership, there's always been that willingness to just not only do what's right, but do what's ahead. And it's worked very well for us.
And I'll say this, as long as I've been in the industry, while there are some very good contract manufacturers out there, I can say from my perspective, I don't think there's anyone out there with a better reputation for quality than Vitaquest. You guys have, I think, the top reputation from my perspective, from what I've seen. You guys do some pretty great work there. And it wasn't too long ago, maybe a year ago or something, I was out there and I took a tour of the facilities, and it was a very impressive place. Not only have I seen many manufacturing facilities, but I used to be VP of technical services for Phoenix Laboratories, out on Long Island, once upon a time.
The famous Rich family.
That's right. And so I know when I take a look around, I know what constitutes a well-run, high-quality contract development and manufacturing organization, and that is you guys for sure. So that's my little testimonial there.
Oh, well, thank you.
You're very welcome. Now, so speaking of quality, Vitaquest was the first dietary supplement manufacturer to achieve the FSSC 22000 certification. What is it that drove that decision, and how would you say that helps to set Vitaquest apart from the other contract manufacturers out there?
Well, for those who don't know, FSSC 22000 is part of the Global Food Safety Initiative, because we've identified that that's going to be the next area. I mean, you can't turn on the news without hearing about some recall of either produce or hamburger meat or something, and that's from people who are not following the rules for food safety. I mean, it can be something as simple as an employee with an infection not washing their hands when they go on a bathroom break. Or it can be that there are no systems in place to analyze in your process of manufacturing, where are the critical control points that can be hazards. Like, for example, if you have a powdered product and you're putting it through a screen to get any lumps out of it, well, that's a critical control point, because one of the hazards might be that somebody's cigar butt might fall in there. Obviously, no one's supposed to be smoking cigars, but I'm just saying you have to identify these. It's called HACCP, which is Hazard Analysis of Critical Control Points. That's all part of this food safety scheme that only the best companies follow. It's crazy expensive. We had to put on a lot more people in our food safety division, but at least we know. I mean, we've been in business since 1978, and we've never had a recall.
Which is absolutely phenomenal. You don't see that routinely out there, and that's a heck of a claim to be able to make, and you guys can make it. So kudos to you guys for doing that. That's a great thing, and of course, you have a variety of other certifications, NSF, GMP certified,
Sport certified
NSF for sport, yeah, a number of areas that you guys have that's always been quite impressive. So let me ask this: there's been an increase in demand for powder engineering capabilities with brands looking to improve like the mixability, the taste, the stability in their dietary supplements. How is VitaQuest helping brands deliver on some of those expectations?
I mean, you've identified a really big issue, which is that it's not like the old days when I used to go to health food shows. They were nothing like the shows.
No.
People had card tables put on, and everybody had a ponytail and Birkenstocks. and yet I secretly felt that they also had bags from Burger King under their tables. But it was different. Those were people who were so consumed with improving their health, or so afraid of being in ill health, that they would pretty much eat anything. They would stir any kind of sawdust into a glass of water and drink it, as miserable as it might be. Now people are saying, yes, we want the best nutrition, but we also want it to not only be palatable, we want it to taste like a milkshake. And that means we want the smoothness, and we want it to dissolve. We don't want it to sink to the bottom of a glass. Well, that actually requires engineering, because you can't just take...
That does.
Like, you can have, protein and you stir it in a glass, and it just, especially plant proteins like rice and pea protein, they sink right to the bottom. But by engineering the particles, it's kind of like the difference between if you took, how can I say this, tea powder.
Yeah.
If you were making a cup of tea from just regular tea powder, you'd only need, let's say, half a teaspoon of it. But it's so hard to work with, and it would coat the spoon and it wouldn't dissolve. That's why they invented instant tea. Right. And instant tea, when you look at it, it looks almost like granules. It reminds me of when I was a kid and I used to drink Ovaltine. And Ovaltine was not just chocolate milk, it also had vitamins and had all this other good stuff, and that's why my mother gave it to me. But the only reason that Ovaltine would dissolve was because it was these little granules, and the granules now would easily mix in. Well, that's what our customers want, especially with things like protein products, greens products especially.
Especially greens, yeah.
Yeah. And we do a fantastic job with that. I mean, where, you can take the greens and you can have them in a little pouch or a stick pack or a sachet, and you can put them into a smoothie or a glass of water or whatever you want, and they just instantly go into solution. So we're doing a lot of that now.
Yeah, and it's very easy for a consumer or anybody in the industry to see something that is well engineered and that will have great dissolution and will disperse very, very nicely in a liquid versus ones that aren't. I mean, one of the things that comes to my mind is when I was looking at a variety of different collagen materials to try to, mixability and seeing some of the very best that had fantastic dissolution and that would mix clear and taste, pretty neutral, and it was great, versus other ones that were cloudy and you could see clumps of it. And it just didn't, so doing it right is huge, and that engineering capabilities. And I was particularly impressed with the one building, I forget which one it was, where you had a lot of different equipment that just was focused on that.
Yes, that's what we call 95P, 95 Prince Street, and it's a phenomenal building. We're doing fluid bed agglomerations, granulation, just all kinds of really high-tech stuff. And it helps us, and even like the granulations and agglomerations that we make, we sell those as ingredients to other ingredient suppliers. So it's been a great acquisition for us.
That's great. Now, Rick, I got something else to ask you. All right. I don't know if you have your wizard's hat handy, but I want you to put it on and whip out that crystal ball. And what I want you to do is, just sort of based on your experience on how things have been going in the last 5 years, whatever. What are your predictions on what you see happening in the industry over the next year, like 2026? What do you see something that's going to be happening? What are your thoughts?
I think from the regulatory end of things, I don't see any big changes coming. But the thing is, if there are, we're going to be more than ready for them.
Yeah, for sure.
There may be a shakeout of contract manufacturers. It's just the way it goes. From a product side of things, I think, if I told you that when I first started with Vitaquest, even in 1993, we were selling almost exclusively tablets. That was the dosage form of choice.
Oh, it was, yeah.
Why? Because the industry had come out of the pharmaceutical industry. And still, when you think about any medications that you might take, a good number of them are probably tablets, with other ones being capsules. Right. But now, the business has shifted, and we're doing mostly powders. And they're powders that are blurring the line now between supplements and functional foods, meaning foods that have a reason for being besides just basic nutrition. And I think we're going to see a continuation of that. I think that there have been some misstarts in that area where it was maybe a little bit too fast trying to mix supplements with foods, and that for me would be gummies. Because gummies, they have to be mostly whatever's making them sweet, and the gelatin or pectin that's holding them together. There's very little room for active ingredients, and if the active ingredient doesn't taste all that great,
yeah, then you have to use all kinds of masking agents, and that may not even work well, and they can be sensitive. The ingredients, if they're sensitive to heat, you've got a problem with gummies. But you know what's interesting about gummies? I talked to you about when last year, when I'd gone to the UNPA conference, we had a guy from Spins there presenting data. And he presented some very interesting data, and they were looking at different delivery forms. And as popular as gummies are, and as many of them that are sold, it's actually, as a delivery form, on the decline. It's declined in sales of them, like about 8% year over year. Whereas, if you look at like capsules and powders, they're continuing to go on the rise.
And even chewable tablets now are supplanting gummies from what we're seeing, because you can fit more actives in them. And there's a lot more that you can do with the flavor of them. They're more portable. Do you know that in the months of April to October, Amazon won't even store gummies in their warehouse?
Oh, I know. It's crazy. You don't get me started on those issues. You got to sign a document saying your product will withstand these high temperatures.
Yeah, 150 degrees.
Yeah. Crazy, right?
You could fry an egg. Another thing that we see is the continued growth of probiotics, and especially probiotics along with prebiotics, postbiotics. And to that end, we are halfway through building a new state-of-the-art, self-contained probiotic manufacturing system.
Really?
I mean, we have a real good one now that you saw when you were here last year, but this one is going to be world-class. We're thinking of selling admission tickets. It's going to be that good.
Wow, that's pretty impressive. Nice. I just wanted to also say that some of the things that you guys do that I kind of like, certainly not exclusive to Vitaquest, but I've never seen anybody do it better, are the sort of the fast dissolving tablets, like fast melts, those kinds of things.
Yep.
I think those are really, really cool, because those are things that you could deliver nutrients in. It kind of gives you that the best in convenience, and it's great for people. Let's say some people eat gummies because they don't swallow pills well, but here you don't have to swallow them. You can let it melt. You might even get some buccal absorption. You might get it, and then you swallow it. You get the rest, and to me, and also in some cases you can get some very fast-acting impact with something like that. So I kind of like those forms. I think they're pretty cool.
I love them. Yeah, they're called in the trade. They call them ODTs, oral disintegrating tablets.
Tablets.
And you put them on your tongue, and they completely dissolve within a minute or less. Think of something like one of our customers had a patent actually on a melatonin ODT. Because
Yeah.
let's say you took melatonin, now you wake up in the middle of the night. What are you going to do? Well, you can just reach over on your bedside table, take one of these, pop it in your mouth, no water needed, and there you go.
That's a pretty cool thing, especially because given melatonin's half-life, that's the issue that a lot of people have. Is yes, it's helped me get to sleep, but now I'm waking up and they need a little bit more, right?
That's right.
So that's cool. Well, Rick, any parting thoughts that you would like to impart from your words, from your years of wisdom, you'd like to impart to our listening audience?
Well, I think what I would say is, like, when it comes to supplements, I was always the great skeptic. But the fact that I've been in the industry for going on 53 years with this coming year, I have learned more than enough to replace my skepticism with a healthy admiration for the industry, where it was, where it is now, leaps and bounds, improvements, especially in that area that's near and dear to me, which is the science. So I would just say, if you have any doubts, just keep on trucking.
Absolutely. Well, thank you, Rick. This particular episode is unlike any that I've done before, although the one I did with Lauren Israelson was pretty fun.
I can imagine.
Yeah, but this one was unlike, because I really legitimately enjoyed the conversations and talking to somebody who has been there, like I haven't even been there longer than I've been, and just hearing what you had to say. So thank you for that. Thank you for being on the Vitamin Professor.
Well, thanks. This was really a lot of fun. I hope we do it again.
Absolutely. And for those of our listeners, if you liked what you heard and saw, please be sure to like and subscribe. We'll see you all next time on the Vitamin Professor. Thanks.